Hi everyone, Ashok here from DHP, and today I'm joined by a very special guest, Dr. Brad Lichtenstein, to talk a little bit about Mindbody Medicine. Dr. Brad is a naturopathic physician with over 20 years of private practice experience, as well as 20 years of teaching experience, primarily at Bastyr University. He's also board certified in Biofeedback and has a clinical focus in naturopathic medicine, mind-body medicine, and biofeedback, depth in somatic psychology, yoga and movement therapy, body work, and end-of-life care. Dr. Brad is also a personal teacher and mentor of mine, so I am truly honored to have him here today to share his wealth of knowledge and experiences with us. So, welcome. Thank you. Let's start with the simple. What is mind-body medicine? This term is thrown around so much now. It's basically a buzzword in the medical world, in the health and wellness world. How do you describe it to patients?
Great question. I could turn that back to you. I'm not going to.
NCAM, the National Center for Complementary and Alternative Medicine, it's no longer called NCAM though, they define mind-body medicine as those approaches that look at the whole person, basically. It's looking at how our thoughts, our feelings, even our body influence our health. The thing about mind-body medicine is it's not about the treatment of disease. It's about creating health and wellness. So modalities that fall under the rubric of mind-body medicine are such things as yoga, meditation, hypnotherapy, exercise, even cognitive behavioral therapy, and then at the end of their long list, they have the word spirituality. They just throw that in there. But it's really how we engage in our life that influences our overall health. People who practice mind-body medicine view themselves as more of a coach and a trainer rather than the person who's going to come in and fix. From the perspective of mind-body medicine, we're not really looking at treating illness and getting rid of illness, as I said. It's about creating health. So we look at health as a whole person perspective. How is this influencing everything in your life? So mind-body medicine isn't just using the mind to fix the body. It's also using the body to restore balance. So that's why I say yoga and exercise are also treatments to be useful, to be used.
Okay, pretty all-encompassing. So another buzzword, mindfulness. Where does that fit into this? Because everybody uses mindfulness. Everyone says, oh, be mindful, or I'm doing mindfulness. Where does that fit in?
Yes, I think, was it this year? I think it was this year that Time magazine has a whole special edition on mindfulness, and it's been on the cover of Time several times about meditation or mindfulness. Mindfulness is a mind-body technique. Yet I like to believe that almost all these techniques are involving some form of mindfulness. The simple definition of mindfulness is awareness of the present moment without elaboration and without judgment. It does come from the translation of some Buddhist texts that were talking about a specific type of meditation. One of the problems many practitioners of yoga and Buddhism and other, even yoga, have with mindfulness is it takes it out of the spiritual realm and make it more secular. Although Jon Kabat-Zinn, he's the founder of mindfulness-based stress reduction, MBSR. It's been used in the treatment of many conditions. It's really about training us how to be mindful. But they've been researching it for things like cardiovascular disease, arthritis, psoriasis, a number of things. But he took mindfulness and wanted to make it secular. He said, let's get rid of the religious perspective because it turns people off and just teach people how to be attentive to the moment. So any technique, even exercise, if you are exercising and you're really being aware of what you're doing, what you're feeling, that is a form of mindfulness. And different than just exercising on a treadmill and looking at the TV screen, or as I see at the gym, people are on the exercise bike and they're playing solitaire on their phone. That's not being mindful. So mindfulness is being aware of the present moment without judgment and elaboration.
Cool. So, no, that's great. And so it sort of fits into mind-body medicine as like as a whole group, as a paradigm. And I guess my next question is, when did this become a thing to like call this group of practice or this whole thing mind-body medicine? Like, was there a time when this term was like coined and then it became something where it played a role in patients' healthcare?
Well, yes, that if you think about the history of medicine and you look at the way medicine used to be, or healthcare, not the healthcare system, but the way we delivered healthcare before 1900, there were approaches that were trying to treat the disease, and there were approaches that were trying to treat the whole person. I mean, if you go back to the writings of Hippocrates, which involved several people, not just one, but if you go back to the writing of Hippocrates, it was really, am I living in relationship to nature? You know, if the sun comes up early, do I get up earlier? If the sun goes down earlier, do I start to go to bed earlier? Do I eat differently at different times of the year? He talked about physis, nature. So to be a physician was to live in accordance with nature. Hippocrates was actually in contrast to some other of the schools in Greece at the time that were really focused on disease. You have a knee pain, let's fix your knee pain. When we go to the United States and we look at the first medical association in the United States, it was the Homeopathic Association, not the AMA. And I think it was 1 or 2 years later the AMA was developed. Homeopaths, herbalists, they're trying to treat the whole person. When that started to change with the rise of the AMA and the American Medical Association, and in the early 1900s, people started to try to streamline medicine. You know, you have this disease, let's give you this. It's easier. I don't have to spend so much time with you. You have diarrhea, let's just give you something for diarrhea. It takes less time than finding out how you're living. In the 1970s, there was a man named Engel who coined the term the biopsychosocial model. And there's arguments about the biopsychosocial model, but what he was saying is we cannot just treat one thing. We're not treating your knee pain. You know, we're not just treating your diarrhea, your digestive tract. We're treating the whole person. We need to know about your socioeconomic status. We need to know what food sources you have. Do you even have access to health care? All of this. And that was in 71 that he started talking about that. He said that for acute conditions, the medical model, the biomedical model works really well. And that's what people say, you know, you have a trauma to your knee, go see someone for the knee. But in chronic conditions, the biomedical model often doesn't work. And so we need to look at the whole person. In the 70s, that's when we saw in the United States, anyway, just talking about the United States, we saw the rise of yoga from other countries coming here. We saw the beginning of meditation. Dalai Lama came over. Don't quote me, even though I'm about to say this. It was in 69 or in 70 that he came over. Acupuncture, Nixon went over to China. And then they started talking about acupuncture in the West. So there was these more holistic systems that came about. And that's when we saw more of a rise of the term mind-body medicine. Because it was separate from, I'm just going to treat that issue. Now I'm going to look at your life. And so I'm going to be doing these meditations, and it's helping my whole health. And I'm going to be doing yoga, and it's helping my health, and exercise, etc.
Cool.
So it was in that time.
So it's been around for a little while now, especially in the United States.
That term and how we look at it.
Gotcha. And how did you get involved? You know, what drew you to be interested and to use this clinically? What got you into it?
The story I've told for years, I tell this all the time, is I took my first yoga class in a synagogue, in the basement of our synagogue in Pittsburgh, Pennsylvania, when I was 7 years old. My mother was progressive. This was in the early 70s. I was always interested in Buddhism and Taoism. However, I didn't even think I was going to go into medicine. I thought I was going to go into the arts. And then when I was in college, that started to shift. It's like I was really interested in psychology. I started a master's degree in psychology and counseling, never finished that. I was just shy of that. And then I decided I wanted to go into medicine. And the reason I actually wanted to go into medicine is when I was doing psychology, I was also doing speech pathology. And I didn't like, back then, that the patients that I was seeing had to see the medical doctor first before they could get referred to other treatments. I didn't really like that. So I was like, well, I want to bypass that. I want to be able to do these things. So I said I was going to go to medical school and got accepted to the University of Chicago, but never went there. Sat in the parking lot for a while and just turned around and came home. And then I found out about this Bastyr place. That's not what my friend told me. It was my acupuncturist. My mom had a 5-element acupuncturist in the 80s in Pittsburgh, and she told me about Bastyr, and so I came out. When I came to Bastyr, I thought I was going to focus on physical medicine. I thought I was going to do sports medicine. I thought homeopathy was crazy, and I became the chair of the homeopathy department. And I do some physical medicine, but not a lot. What happened is I would see my patients, we would talk about the biochemical stuff, we would talk about diet, nutrition, herbs, and that took 5-10 minutes. 10 minutes. And I never saw that being the main thing that helped them.
Yeah.
So I just started talking about, like, how are you doing? What's going on? How's your orientation to your life? How are you engaged in your nervous system? And those were the fundamental questions. Those are the things that I saw significant changes with. Yes, I think diet is really important too. And it's not even telling patients, you need to sleep more, you need to exercise. Because how many doctors say that to patients? How many patients know that? That's not the issue. What's keeping them from doing them? What's the payoff for their behavior? That takes a little bit more time than just 2 seconds. So when I graduated, I was doing HIV care. I worked with some HIV organizations, and this was in the early mid-90s. And I found, like I said, the appointment took 10 minutes to talk about some of the medications and supplements and everything. And then we talked about their life. And so all the stuff that I'd learned in the past from yoga and meditation started bringing back in with my patients. So it was really like a returning back to the stuff that I already valued.
Fair enough.
And it just kept growing. I mean, I would find that the more I talked to people about things, the clearer it got. I was part of a hospice study where I was at bedside of 500 bedside hospice meditations I did with patients. So I would go twice a week until they died. So they signed up for the study. And during that study, I would see what happened from just a guided meditation. I saw people's pain decrease, I saw people's breathing change, I saw anxiety change significantly. And they were already on serious medications. They were on morphine and everything, and I would watch that change, document it. And although I already believed it, it was just like, okay, this is it. This is it. Other things still have purpose. But if we don't talk about how we are being present in our lives, we're missing so much.
Fascinating. So,
I think so.
yeah, I do too. So, you've done it for a long time now. What have you seen change? How have you seen the field evolve in, how is mind-body medicine used in clinic now versus back then? What's different now?
So if you mean back then when I graduated, that's a great question. I think it's something that you already mentioned, that one, mindfulness, the word is used so much now, so I think there's a lot more acceptance. Jon Kabat-Zinn who started MBSR, it was relatively new. And in the 90s, it was still gaining more prominence. I think there's way more studies. I actually was on a research panel reviewing research studies for the NIH. And at that time, which was, late 90s, there were only two types of meditation that were accepted, MBSR and Transcendental Meditation, TM. So if anybody wanted to propose a new meditation style, they threw it out because they said there was not enough research. That's not the case now. There's more that's coming up. So I think there's a greater acceptance. MBSR, that specific approach, which is a 6 weeks meditation approach, that you can find in almost every healthcare setting and in hospitals in the country. There's a high prevalence of it. Yoga studios. Since I moved to Seattle, I mean, there was a huge growth in yoga studios. There were hardly any when I moved here. So that has changed. And more research on all of these things. That said, I hear more people just talk about it, but not necessarily do things. So doctors say, you need to go do that. The other thing, biofeedback, which has been around for a long time, 69 and 70s, it was coming into fruition, but as the whole field, now a lot more people are certified in using biofeedback. More neurofeedback, which just focuses on brain waves. But there's a lot about that.
That's perfect, because that was going to be my next question, is how does biofeedback as a modality fit into your mind-body medicine practice? Like over the years, like you're saying, there was an increasing acceptance and popularity, even research studies and support and evidence. But did the conditions looked at or treated change? Did the assessments and tests that you use, or treatments, or modalities like biofeedback, did those change significantly, or is biofeedback really the big one that has become more prominent?
I think it's become more prominent at Bastyr because I've been trying to teach it, and I know they do that at some other the naturopathic schools. I have multiple answers for that. The way I was going to answer that. The way I'm going to answer it is this. My perspective has changed about the nervous system. And I think that is new information that's coming out that is shaping healthcare in general. I hope it has a potential to shape healthcare. There's a lot of work about the neuroscience, about emotion, about trauma, how things happen. So I just want to reiterate, the way I work when I'm working with patients is not to treat conditions. I'm not treating conditions. What I want to look at is how their nervous system is regulating. Because the nervous system is the master regulator for everything we are treating. And naturopaths espouse to treat the whole person, not treat the condition. I mean, that's what we say, correct? So if somebody has hypertension, rather than treat the cardiovascular system, how are we not looking at the regulator of the cardiovascular system? What makes the heart speed up, slow down? What causes blood vessels to constrict? So my understanding of the way the nervous system working has changed significantly from when I went to school. And how I'm teaching it has changed significantly. And the research has changed significantly about that. So I think that's what we're doing, and that fits nicely with mind-body medicine. Because we're saying, okay, if you can look at how you're participating in your life, it will change downstream. Where biofeedback comes into play is biofeedback is just a way to give the patient more information about themselves. Because it's that mindfulness piece, right? I want to be mindful of how my posture is, how I'm breathing. I'm not aware of all of those things. Or when I'm thinking this, when I'm ruminating about my taxes, what happens to my blood vessels or my heart rate? With a biofeedback machine, I can see that, and hopefully it helps the patient go, oh, wait, I wasn't feeling that. So that they can begin to feel it. So I think biofeedback is just another adjunct to all these other mind-body modalities and gives it help and gives it more information and helps the patient become more mindful and aware.
Okay.
That was a long answer.
No, but that makes sense, and that kind of, it segues nicely into what I wanted to ask about, which is, you kind of just said it, mind-body medicine fits in very nicely with naturopathic medicine. It fits in with how we're trained and to kind of think about the body, treating the whole person, and not just the condition. But specifically, do you find certain principles or certain practices guide the way you use it?
Certain principles in naturopathic medicine?
Yeah.
Yes. Docere has always been one of my favorite principles, doctor as teacher. And I find that I spend a majority of my first few sessions with people educating them about the nervous system. Educating them about how their body works because they're not aware of how their body works. And so then they blame themselves or judge themselves for having symptoms, but they don't even know how they came about. So I spend a lot of time educating people about the nervous system and about their behavior so that they create awareness. The next principle, of course, is treat the whole. I mean, I'm looking at the whole and trying to understand the cause. So totally causum informs my nervous system focus. So I'm just really fascinated by the naturopaths who really are jumping on the bandwagon of pharmaceuticals. It's not that I'm saying pharmaceuticals are bad. That's not why I went into this program. I did HIV care. All my patients were on pharmaceuticals, and they saved their lives. And I did use naturopathic herbs and supplements and herbs to help mitigate side effects of medications. And while that helped with people's symptoms, how they felt about their life really required more depth work, more conversation about how are you engaged in your life. So, I see that as vis medicatrix naturae, stimulating the healing power of nature, trying to understand what that person's nature is, really listening to them, understanding them, because then I see their vis expands.
Okay. And so, you're saying if that's the primary way that you're looking at a patient, a patient comes and sits down in your office and you're doing this, you're working with them, you're understanding them, pretty low on the therapeutic order?
Oh, okay, yeah. Low on the therapeutic order. Depends on whether you...
As far as, force of intervention.
Yeah, yes.
But it doesn't affect the effectiveness.
What do you mean by that?
In the sense that, what I've noticed is sometimes people have this misconception that if you are lower on the therapeutic order with a lower force intervention, the effectiveness is also lower, or how hard therapy is. So the higher you go, the more effective it is. But it's not necessarily true.
I have said to classes, I say this to patients, I say this every time I talk about this, if you have essential hypertension, benign essential hypertension, so it's not caused by any other physiological conditions or medications or something, all you need to do is breathe. You need to learn how to breathe. There has not been one patient who has had essential hypertension that I've worked with where I haven't seen in office their blood pressure drop significantly. Not one. The only time it didn't drop, the person actually had some kidney damage, and that was one of the issues. I found that out afterwards. Now, that's not to say that one session did anything. If the patient does not practice breathing, if they don't do homework, if they don't do something every day to change and learn to breathe that way all the time, their blood pressure is not going to change, and that can lead to heart disease. So if they don't do that really easy intervention, something can happen. But yes, I've seen insomnia, I've seen seizures, I have seen hypertension, cardiovascular disease. I've seen IBS. I've worked with tons of patients with IBS who've been through Bastyr, who've been to the clinic, changed their diet, all that, still had IBS symptoms. And when we did some either breath work or some other biofeedback training, they didn't have the symptoms anymore. So it's simple, low force, but it requires practice.
Right.
Some people don't want to do that. A lot of people might not, maybe. And I also don't want to do what a lot of doctors do. I hear them say, oh, the person's not ready to do that, or they're not going to practice. And they never ask. Or they never educated them about how effective it could be if they do that. And help the patient understand they've already done practice. They know how to drive, they know how to walk, they know how to write. Some of them are athletes or play instruments or something. They've practiced a skill many times and excelled. It's the same thing. So many people will say, oh, I can't practice, I can't do anything. It's like, you've done so many things. That's the other part of mind-body medicine. We're not just looking at the problems, we're also looking at your successes. How have you actually cultivated positive things in your life? You have, or you wouldn't be alive. Right. So we bring that into the fold. So yes, it's low force. It requires a little bit of time and focus.
Kind of like exercise. And me personally, I know that that's always been my argument, is that, daily life takes practice. Everything in the human experience takes practice. You have to live the human experience. So why should exercise, when you're trying to change your health, be any different? Why should nutrition or mind-body medicine type modalities be any different?
And what's so interesting is when you look at the studies on anxiety or depression, many of them came out of the University of Miami, but the ones that looked at exercise, group therapy, cognitive behavioral therapy, and the impact on anxiety and depression, exercise always seems to reign supreme. Now, when you compare exercise and yoga seems to be a little bit better. And I can show you those specific studies. And the thing that it seems to be is that with exercise, you can be doing it and not really paying attention to yourself. And with the yoga, people really were focused on the breath and their posture. But it's movement. Movement is the main thing. And people, I have had so many people say, when I did do that, I felt better. But then the next day, dude, that's my job, to help them find how they want to do that. There you go.
Okay, so I know you said, like a lot of naturopaths, and we say we don't treat conditions, we treat patients, and we treat the whole person. But how does somebody know that they should be going to somebody who does mind-body medicine without knowing the conditions that you can treat? So are there some common conditions, or what are the most common conditions that you do see that end up that patients walk in suffering from or dealing with in your office, or that you see most often studied with mind-body modality?
Okay. I'll answer the first part, that at Bastyr Center for Natural Health and in my private practice, the main conditions that I see people coming in, anxiety, PTSD, trauma, hypertension, and IBS. Those are the main things that I have seen. Others include insomnia, depression, chronic pain. I should say that, just chronic pain in general, not necessarily specifically low back pain, migraines, TMJ, so that can fit with the pain thing. I think those would be the main. And so when we get into the main conditions and efficacy for mind-body medicine, you have to look at which modality we're talking about. Are we talking about biofeedback? Are we talking about MBSR, mindfulness meditation, transcendental meditation, autogenic training, which is a different type of modality, hypnotherapy? I mean, all of those. And there's a lot of studies out there. For instance, There are some studies that show mindfulness is helpful for hypertension. It does nothing for hypertension. The problem with those research studies is they're looking at an approach, mindfulness-based meditation, to fix a condition when mindfulness is about really creating awareness. And it's not about any change of condition. In fact, the primary goal of mindfulness meditation is not to change anything, just to be present with it.
What's interesting in the studies where they show mindfulness does help with hypertension, we can make an association. We can start to say, the way I'm viewing my hypertension or my life is creating more tension and resulting in my blood pressure. With that said, we could use any of these mind-body techniques to alter our relationship with our symptom. So I find that they're all effective in some way, not necessarily in eradicating or getting rid of the condition, but helping manage the condition, or even help our mood in relationship to this condition. And remember, I worked with people who were all in a hospice study and they were all dying.
Yeah.
The goal was not to prevent them from dying. I mean, that would have ruined our data too. But the goal was to see if it improved the quality of death, their quality of life they had before they died. And I believe we saw it. So it really does depend on what you're really looking at.
Right. Okay. And so, if we were to do a little comparison, in simple terms, we see a lot of these conditions that you kind of listed off, and obviously you could take forever to talk about them, but the common conventional treatments for a lot of these, how do they compare? How does the conventional treatment compare to, the naturopathic or the mind-body medicine modality equivalent as far as like force of intervention or therapeutic order or?
Well, yeah. And you already mentioned that. You already asked that. I mean, if they're lower force interventions. But for instance, in many of the biofeedback studies, and a lot of the biofeedback studies, just to be clear, biofeedback being a process where you're getting information about your physiology. So they hook you up to sensors that measure your muscle tension, your heart rate, your breathing, a number of things, temperature, sweat, skin conductance, brain waves. A lot of the biofeedback research studies that look at post-concussive syndrome, that look at headaches, hypertension, pain, even IBS and some other things. The difference in approach is you come in and you are followed. You come in weekly for sessions for maybe anywhere from 6 to 12 to 24 weeks. So when you talk about level of intervention, that's time, that's money, that's time. Since you're learning new ways of either breathing or holding your muscles or relaxing, coming in weekly is really important. It's no different than hiring a coach. If you're an athlete and you're on a team, it's no different than going to practice every day and having your coach tell you what to do. So it's really important. The studies on PTSD, for example, and hypertension, they're about 6-week studies. That's it. 6-week studies of learning how to breathe a certain way, and you see changes. So you can go see the doctor, get a medication, get an herb. We do that too, get an herb, and then come back in a month and check in on how you're doing. This is the way we follow you for 6 weeks. I think the outcome is better because I was going to say always, most often see, since we're not treating the end organ, we're treating the whole person. I teach somebody with hypertension 6 weeks of breath work. Not only is their blood pressure low, they're sleeping through the night. Oh wow, their GI tract isn't upsetting them anymore. And we did one thing, which is a huge thing. We did one thing, so I don't need to give an herb for this, an herb for that, adjust this, fix that. I'm working on this, I'm working on their whole nervous system, and it branches out in so many different areas. So if you want to stay cost effective, if you're seeing conventional care, you don't have to see the gastroenterologist, the cardiologist. I don't remember the other thing that I said, but whatever it be.
Right, the sleep specialist or
Yeah.
whatever it be. Yeah.
Exactly.
Okay.
So I think that's
It's
more effective.
definitely. That's awesome. I think we touched on everything that I wanted to talk about to get a little bit of introduction to what actually is mind-body medicine. Now this next part, this is a little bit more for you to get on your soapbox a little bit.
I haven't been already. Okay,
This is very direct. So I'm going to ask you to just list something I like to call our top three. So the top 3 things that you would say people should avoid to optimize health and wellness.
The top 3, and this is my soapbox.
Yeah.
Okay. Social media. As I say that here. I had a friend who was going through educational technology, a degree program at UW. And this was in the 90s, and we were talking about emails and everything, and I was saying, oh, it's so bad. And he's like, no, this is the argument, right? No thing is really bad, it's how we use it. So I'm not going to say social media is bad. I'm going to say no social media, no cell phone. So this is my bracket, so this is 1, not 3. 1, no phones in your bedroom. No phones in your bedroom, no social media after a certain time. Maybe those are 2 different things. Limit your social media. There is so much research showing that the more friends you have on Facebook, and not from a business perspective, because I know people use it that way, but friends you have on your personal Facebook page, the more unhappy you are. I see people constantly worried about, did I get a like? It was 2 seconds after I posted it. So really limit the use of social media and do it for what you want to engage. But what we find is people who use social media for social support feel a lack of social support because there's no one around them. Put down the social media and go and do something. So I would say that's 1. It has its place. You can use it effectively. Use it for the way you want to connect with people, but actually connect. Nothing, this gets to maybe something you'll ask later, but nothing can replace connecting with people. Live. So, don't use social media as a substitute. 2, get off your computer and your phone hours before going to bed. It will disrupt your sleep. Most Americans, I don't know about Canadians, most Americans have sleep deprivation problems. Lack of sleep and poor sleep changes all your hormones, affects everything. Don't do that. All those sleep hygiene things they say, So, do I have another one?
Yeah, do you have another one?
Oh, God. To avoid?
Yeah.
The only thing that came up was McDonald's. Fast food.
That works.
Yeah, I don't know where that went. Those 2 are the biggest ones. What else to avoid? Going to a doctor. My patients in the end-of-life study who lived the longest were the ones that said, I never listened to anything my doctor said. So, don't search the internet for your health conditions. Okay, there. I tied it together. McDonald's,
Gotcha.
Those first 2 are really important to me.
Gotcha. So what about 3 daily practices to, encourage balance and health on a daily basis?
Avoid social media. Turn off your phone. 1, get up and move. And that doesn't mean you have to exercise. I mean, that would be nice. But get up and move. Do not be sitting for more than 20 minutes. And I'm at fault at that. What do I teach? I teach at school. We have classes for 2 hours, 3 hours. I could talk forever. Get up. I'm telling the students now, I'm trying to put that in the syllabus. Get up and move. Don't sit in these chairs. I could say your education system is causing poor health. They're doing it to you by requiring you to sit. So, every 20 minutes, move. I think that's really important. The other thing is to have some time of silence. And when I mean silence, I mean like radio silence. I mean internet silence. Sometime, so we could call it silence, but sometimes just reflect and be present to what we're experiencing. That's where all the mind-body techniques come in. It could be yoga, it could be meditation, it could be prayer, it could be eating mindfully, whatever it is, sometime where you just sit so you can really reflect on what you're experiencing and feeling without being bombarded by other noise. And this is not just at the end of the day before you go to bed and then you fall asleep. It's throughout the day. We switch gears so many times so quickly. The mind can't really multitask. There's not multitasking. It's switching back and forth through different things, and some people think they excel at that. The problem is if you hardwire your brain to excel at that, you don't know how to turn it off. And that's going to cause all these health things downstream. This is my downstream area. It's over here. This is where all the diseases are. I hear people say, well, I can't sit by myself. I get antsy because their nervous system's not used to it. They feel like they have to be looking at something. They're on guard for something. Spend some time, cultivate time in silence. It doesn't mean you're sitting with people and not talking, but where you can reflect, breathe. Your walking could be doing that too. So I think that's so fundamental. And then the third thing that I think is really important is social connection. I know there are people who live certain places so they're not connected, but how do you form social connection? So many people are isolated for that. I truly believe, and we didn't go into the nervous system specifically, that social engagement, not via Facebook, not through email or texting, but social engagement. The voice is better than nothing, because if you're on the phone, you hear someone's voice, you connect with their intonation. That does something to your nervous system. If you're FaceTiming, I'm telling you, put down the screen, but if that's the only way to get social connection, you can see facial expressions and hear the voice, so that's useful, but there's nothing better than being in the presence of somebody. And if you are isolated and if you feel you can't, get a pet, because that will help. It regulates our nervous system. It's the master regulator. Being with people, like-minded people who support us. So if you find that all day you're around people who are critical and picking on you, that's not necessarily helpful for your nervous system. Too often I hear people say, I'm too tired, I don't want to go out and do that. And then when they do go and spend some time with people, they feel energized and they feel better. Social engagement. So the second one, when they're saying be silent with yourself and spend some time, that's actually self-engagement. That's engaging with ourselves, and the other is engaging with others. So that's what I really think our daily practice is. Move, which means you engage your body and you have a relationship with it. Be silent so you can engage with your emotions, thoughts, and feelings. And then engage with others. I think that can heal a lot.
Okay. So our last three that I'd like to ask is just 3 tips for just optimal health. It doesn't have to be daily practices, just 3 general health tips.
Those were the ones. I think that the daily practices are the tips. I don't think there's one thing to do like a one-time, one-off. It's like these are daily things that will really change your health. Okay. It takes dedication and practice. I think of it like if you want to learn to play piano, you practice your scales. You're not even practicing that major concerto. You're practicing your scales every day, no matter how many years you've practiced. And you keep doing it because it reminds you of how you want to be. I think the Dalai Lama said I think it was in The Art of Happiness, something about how he gets up really early in the morning and meditates for hours, and that's the first time. And when asked, okay, why do you do that? He said, because it reminds me how I want to be that day. So I think these little things have major consequences. So I'll say that to optimize health, those
Is maintain your daily practices.
maintain your daily practices.
Okay.
And don't beat yourself up on the days you don't. Practice self-compassion.
Okay. Maybe that can be your third avoid.
Okay, yeah, okay.
That's perfect. Dr. Brad, this was wonderful. I want to thank you very much for joining me, talking with me, and entertaining some of these questions I had. But before I let you go, I know people are going to watch this and they're going to be like, that's so cool. Because I'm fascinated by it. You're obviously fascinated by mind-body medicine, how the body works, and how to treat the whole person. Where do people go to learn more about this or to learn more about you? You know, how do they follow what you're doing and what you're talking about? You know, do you have social media?
I do have social media that I struggle with doing at times, but I do have a website. It's thebreathspace.com, www.thebreathspace.com. And on that, I actually have some of my guided meditations, so people can download those for free. They can listen to them. I have some of my articles that have been published. No, I do have an Instagram thing and some other stuff. I'm not as good as the Facebook and the Facebook and the Instagram. I also have a private practice, so you can find that through thebreathspace.com. Other places people can go. I mean, I'm excited because I've helped train a number of practitioners out there. The Bastyr Center for Natural Health has a mind-body medicine shift, so people can go there. If they're interested in mindfulness specifically, several hospitals in the area offer free or really low-cost mindfulness-based stress reduction programs, so they can check that out, MBSR. And then there's just so many other techniques. There's a number of biofeedback practitioners that are naturopaths that got certified. People can find out about that on the bcia.org website, bcia.org website, and find a practitioner. That's Biofeedback Certification International Alliance. I should know. I should know that one.
So you can find a practitioner in your area, and if you find somebody who's board certified, psychotherapists, physical therapists, naturopaths, medical doctors, you don't have to be certified to do biofeedback, but that certification is just another indication of level of proficiency.
Okay.
So you can always look there if you're interested in that. There's way more other places to find people, but
Wonderful.
that's a start.
Great. Again, thanks so much.
Thank you.